My name is Cheluchi Onyemelukwe, Professor Cheluchi Onyemelukwe. I am founder and executive director of the Center for Health Ethics, Law and Development, CHELD, which is a national non-profit in Nigeria that does international work as well. It is a non-profit that is focused on using research, education, advocacy, and practical development projects to make a difference in the area of the right to health, the area of universal health coverage. We do a number of things. We have a number of programs, including programs on gender-based violence, non-communicable diseases, disability, migration, and other areas. These are our main areas. We work primarily in the area of policy advocacy and research. So we've contributed to a number of legislation, a number of laws and policies in the country in these diverse areas that I've mentioned. Like I also mentioned earlier, we also do practical development projects. So we take on projects where we actually go in and support people, which is what brought us here. So we work in the area of migration, health and migration. Migration, of course, we often think about internationally, people crossing borders, migrants crossing borders, issues around things like irregular migration, where you talk about smuggling of migrants and trafficking of victims of trafficking. So we've done a lot of work in those areas. We've supported a number of organizations working in those areas, from the African Union Commission to British Council and so on. More and more we're beginning to look at internally displaced persons, because while migration is international, we also have internal movements, and internal movements can sometimes be precipitated by violence, by conflict and insecurity. As we see here, we have a camp of people who have been forced to leave their homes because of conflict. We think that it is important that they also enjoy the right to health. This year, the theme for the World Health Day was Health for all, including migrants, all, including internally displaced persons. So we had a number of ideas. We thought we would come in here and do a lot of research and ask what is going on with the internally displaced persons. We know that Nigeria has a national policy on internally displaced persons. Where are we with things? And when we came in to do the research, we were taken aback by how bad the situation was. So typically, we do a lot of evidence gathering. We do a lot of, policy development and policy advocacy. And because of that, we do quite a bit of research. But we felt that it is important that we also do something actively on the ground. And I know that there are a number of organizations that have been doing so. But, just looking around, just talking with people here, we see that the challenge is, it's enormous. It's very troubling. They almost look like they are no longer part of this country, and yet they are part of this country. They are Nigerians like everybody else. So why is nobody asking questions? Why is nobody saying, why are they living like this? This is not their home. They still live in this place as though it is temporary, but yet many of them have been here for years. There is poor access to health care. I don't want to get into the details, but even though there are health centers, they are required to pay money to access care. And of course, you can see how wretched some of them are. They can't afford that. What that means is that the death toll is high, but we also still see quite a number of pregnancies and children coming in. So why is that not a concern? And that's the question that we're bringing forward. And this is not the only camp. There are several camps. Our idea was to come in and, begin to advocate very vigorously alongside other organizations that are working in this area. However, like I said, when we came in and saw the wretchedness of the situation, we determined that despite the fact that we are self-funding this project, that we would do something actively practical to support our fellow Nigerians who are in this situation. And so we thought that we would do this medical outreach. It is only one strand of the work that we intend to do going forward that we're already doing. So for example, the research, our baseline survey is already ongoing. We're already doing that. We've identified a number of areas where we're looking to support, and we're already looking for partnerships that will help us to support here. We've talked to a number of organizations and companies that have expressed interest in coming alongside us to work in this area. However, our main goal is not just to support, practically support this project. Our main goal is to draw attention to this issue, to ask questions. What has happened? What has happened to the implementation of the policy? What is government, the NC National Commission on Refugees, migrants and internally displaced persons, what more can they do? This is not to say that nothing is going on, but I feel like we need, that extra push to make sure that we begin to address some of the situations that we're looking at. No one small organization or even big organization can do it without government support. We need to understand what is happening with education. There are so many children here. While there is a primary school, there is no secondary school. How do we ensure that they have some skills to get rehabilitated back into society and not continue to live here in this way? If we say that they should live here in this way, then obviously more needs to be done to make this place habitable, to provide basic living standards. While we can't answer all of those questions, what we want to do is to bring attention to it. But while bringing attention to it, we thought that we would also do something practical, and that's where this medical outreach comes in. Going forward, we have programs that are going to be that are around psychosocial support. There's a lot of trauma, as you can imagine, and quite a bit of mental health challenges. And mental health is something, mental illnesses are things that require ongoing care, and we are willing and devoted, because of our work and our commitment in that area, to ensure that that happens with the people that we identify that need support. There are a number of other areas that we intend to work in, which also has to do with economic reintegration and sustainability, because you really want people to get to the point where they leave this environment and they go on and they have a life. But again, as part of our advocacy, we're looking to have other organizations come in here, other organizations ask questions. If you look at the literature, you will notice that people have recently, especially at the beginning of this year, it was actually an article that I read that made me think, let's actually go and see what are things like on the ground there, because we often talk about it, at this level, but we need to really come down to the ground, look at people, see them as people, and recognize that they have rights to live, to have an adequate standard of living, to go back home if that is at all possible, and to have government support those initiatives so that one day we will no longer have IDP camps. Yes. Yes. No. So this is, we sometimes get funding for some of our projects as an NGO, as a non-profit, but this is funded by the organization itself. This program, this whole project, which, like I said, has different components, the research component, the advocacy component, but also the practical development side, which is what we're doing. That's where we're funding that ourselves. Well, funding is always a challenge, right? Sometimes you have a limited budget to work with, and to make that happen, you need to sort of balance things. But we've also had quite a bit of support. We have doctors here of different specializations. We have, dental surgeons, we have eye care specialists, we have people in counseling, we have pediatricians, amongst other fields that are here, and they are giving their support practically for free. The main thing that we have really had to fund are the consumables and all of that, the logistics and the consumables. So I actually also want to use this opportunity to acknowledge them and to thank them. Many of them are doctors and specialists from the University of Abuja Teaching Hospital, and they've come alongside us to support us in this project. Yes. Okay, so I mean, we've had other events here. We had an event during the menstrual hygiene day. I don't remember, one of the days about a couple of months ago, and we had quite a huge turnout. And today there's been a significant turnout as well. People coming with their children. What we noticed that we have quite a number of mothers with children coming, but we've also, because of the other special areas. So we've had the dental surgery today, and we have people seeing, people who need oral care, and we've had people receiving eyeglasses and all that. So we've had quite a significant turnout, and we're very, very excited and very pleased.